So today I'd love to go over this case that is super interesting because it just showcases a lot of what is involved in getting these smiles placed into these patients' mouths and what happens when they wait so long to actually have this done. So before we start to talk about this case, please click the button below and subscribe. This unbelievable patient, when he came in, he's been wearing a denture for quite a long time. What happens when you wear a denture, a lot of people don't realize is, yeah, you're not able to chew correctly, you don't feel the way that you want to, but even more importantly, the musculature of your mouth has to help in keeping the denture in. So I want to show you how his first smile was. If you look closely, you can see that when he smiles, although he has a really beautiful smile, his lower lip is pushing in to keep that lower denture in. And a lot of denture wearers, what happens with them is that they say, oh, we can do what we need to do, we can bite and all that fun stuff. We can bite and be able to eat whatever we want, but what they don't realize is that they're now training the outside to be able to work with the inside. And that means that they start to clench and use muscles that they're not supposed to, or stop using muscles that are part of their muscles of facial expression, and everything changes. And that's one of the things we learned about this case. When we went ahead and we took a CT scan, and what the CT scan showed us is that we'd have to be very innovative in the way that we placed our implants. So we went ahead and did our whole workup that's proprietary to us, called the XCell Implant Process. We designed his teeth on the computer based on his smile and make sure that everything is correct. We went ahead and we did the surgery. We gave him his temporary teeth. Everything looked the way it was supposed to, and he went home. When he came back 2 weeks later, what was super interesting is that he smiled and the teeth didn't look the way they were supposed to in relation to his face. And we hadn't caught it yet that he smiles differently. So we did our typical work to be able to make the teeth straight in the way that was. And we did it and everything looked perfect. We put it in his mouth and it looked like it was the other way. And we started looking at all of our data and we said, wow, you compensate to smile differently every time. And what was happening is that since the day of his surgery, because his teeth were in his implants and they were no longer moving, he was now activating different muscles in his face. And every week, the smile looked different. Anyhow, push come to shove, we were able to finish this case, make it look perfectly straight. His life is gonna change. He no longer has to take out his teeth. He no longer has to hold his lower lip to keep his lower teeth in. He can now just start living life, order the food that he wants, chew the food that he wants. He still comes and sees us every 3 to 4 months to have his teeth cleaned. But other than that, he's got a new lease on life and he can now reactivate all the muscles of his smile, or as we call the muscles of facial expression, to show the world the way he feels and live his life to his fullest. If you like this video, follow me and subscribe to see more of these.